Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, in the H. pylori, if you have to assess the success of treatment of H. pylori, for assessment of success of treatment of H. pylori, actually non-invasive tests are mainly preferred for the assessment of success of choice of treatment. So urease breath test is actually the best test of choice for documenting eradication. Urease breath test is the test of choice for documenting eradication. If breath test is not available in any area, then we can do a stool antigen test can be considered for the documenting eradication. So a stool antigen test can be done for documentation of the eradication if urea breath test is not available. Second, then serological testing is not used for documentation of eradication. Why? Because serological tests mainly depends upon the antibody titers, and the antibody titers fall slowly and often becomes undetectable also. So they fall very slowly, either they fall very slowly or sometimes they might become undetectable, that the serological test might come negative. So as a result it is not useful. Best test is urea breath test, and if it is not available, stool antigen test is can be done. Then, if you see the invasive tests are actually not preferred for the documentation of eradication of H. pylori. Like biopsy based tests like biopsy urease test or histology and culture of the organism, these can be done. These are the invasive tests which are actually done by an endoscopic biopsy. These are done or these are based on endoscopic biopsy. So these tests can be used for documentation. You can use for documentation, or they may be used for documentation, but actually they are not preferred because already the infection is already gone. So it is not preferable to use it for the uh, eradication. Invasive tests for eradication is not used.
thank you and thank you for watching.